Hi, my name's Allison Brown, and I'm a student nurse at the University of South Alabama, and I'll be doing my medication administration checkoff today. So, this is my area. And the first thing that I'm going to do is verbalize that whenever I'm preparing medication, I would have the door to the medicine room closed, and I would not be answering any phone calls, and I would limit my conversation with my colleagues just to stuff that was important. And then I would also follow my agency's policies on the no interruption zone. So the next thing that I'm going to do is I'm going to get my MAR and my patient care order form. And I'm just going to put them side by side, and I'm going to compare them, make sure that everything's right. So the first thing that I'm going to look at is the name of the patient, which is Jaguar J. Jones, Jaguar Jane Jones. The date of birth is 08/25/1963, 08/25/1963. And then the medication that I will be administering today is heparin, so I'm going to look at heparin and find it on here. So heparin matches. And the dosage is going to be 5,000 units and 5,000 units. The route is subcutaneously and subcutaneously. And then the time is every 12 hours and every 12 hours. And then the indication for it is heparin is an anticoagulant, so it is gonna prevent those blood clots. And I'm also gonna look at my patient's allergies on these, and he does have a penicillin allergy and penicillin, so they match on here as well. So the next thing that I'm gonna do is I'm gonna perform my hand hygiene, and I'm gonna move into my first check. So now what I'm going to do is just go to my MAR, and I'm going to look at the patient name again, so Jaguar Jones, and 08/25/1963, and make sure that is all right. And then I'm going to look at the drug, which is heparin, and I'm going to pick it from my medications, and it is this one right here. So we have heparin, 10,000 units per ml. We have heparin on here, and the expiration date is 12/5/2025, so we are in date. And so make sure those drugs match on the MAR. And then next we're going to be looking at the route for it. So on the MAR it says that it is subcutaneous. And so I'm going to select the right syringe for it, and so I have a 28 gauge 1/2 inch syringe, and it's a little brown down one. And for my dose, I have, on my MAR we need 5,000 units, and since this is 10,000 units per ml, I will be administering 0.5 ml for my dosage. So what I'm going to do is take this out of the package, and I'm going to clean the top of my vial. And I'm going to draw back, I would normally leave that cap on, draw back 5.5 milliliters of air, and then I'm going to inject it into my vial. And then I'm going to pull back my right dosage, which is 0.5. Make sure that I do not have any air bubbles. Perfect. And then I'm going to use the scoop method to put that cap back on. I'm going to show that I have 0.5. Okay, and then for my next check, for my next thing is time, And so it is every 12 hours, and my patient hasn't had heparin in the past 12 hours, so we are good. And then my indication is heparin is an anticoagulant, so he's going to be getting it for blood clots. And for my documentation, I would document my entire legal prescription. And after I administer it, I'm going to document if he has any reactions with it or anything like that. So now I'm going to move on to my second check. So again, I'm going to start by looking at the patient. Jaguar J. Jones, date of birth 08/25/1963. And our medication is heparin. And again, we have it on the MAR and on our vial and in our syringe. And 5,000 units. And since this is 10,000 units per ml, we did 0.5 to make 5,000 units. And then subcutaneously, so we have the right syringe for that. Every 12 hours. He hasn't had it in 12 hours, so we're good. And then my indication is to prevent blood clots, since heparin is an anticoagulant. Then my documentation, I would document the entire legal prescription, everything that had to do with it, and then after I administer, if my patient had any reaction. So now what I'm going to do is prepare a label. Oh no. And I'm going to write on it my patient's name and the medication and the dose. So we have heparin, 5,000 units, and our patient's name, which is Jaguar Jones. Okay, so now we're going to put that on our syringe. So now that is labeled. And now I'm going to go to my patient's room. And with me, I am going to take my MAR and my heparin vial and my medication that I just prepared. Okay. So now that I'm in my patient's room, I'm going to perform hand hygiene, and I'm going to explain the procedure to my patient. I'm going to let him know that what medication he's going to be getting, which is heparin, and that it is for to prevent blood clots. And then also I'm going to raise the bed, and I'm going to lower the side rails so I'm able to access. And then the next thing that I would do is pre-assess him and get his vitals, and make sure that we have like a baseline just in case that I didn't administer this medication. If something changed, we would know it. And then next, I'm gonna put him like this, and we are gonna make sure to identify, let me do this first actually. We're gonna start our third check, which is identifying our patient first. So I'm gonna look at his wristband, and we have Jaguar J. Jones and Jaguar J. Jones on our MAR, and then we have date of birth 08/25/1963, 08/25/1963 on our MAR, and then also I see that we have a penicillin allergy, and that matches on our MAR as well. So next thing that I'm gonna do is prepare to talk about the medication. Yes, make sure we got it right. So that we have the heparin is what we're going to be administering, and I have it here on the vial that I brought with me. Heparin, 10,000 units a milliliter, and since we only needed 5,000 units, I have 0.5 milliliters in my syringe, and I have it labeled correctly. So we know that the drug, the dose, and the route is all correct. Next is going to be time. We know that from the MAR it is every 12 hours, and He has not had it within 12 hours, so we're good. And then also, again, for the documentation, we would make sure to document the entire legal prescription, and then if my patient does end up having any interactions, I'm going to document that as well, or if it ends up being therapeutic, working, all that. So the next thing that I'm going to do is I'm going to put on my goggles, then I'm going to put on my gloves, and I'm going to assess my patient's skin and make sure that there's no bruising and that my patient's skin integrity is good, so that we know that this shot is going to do right for him. Okay, so next thing I'm going to do is I'm going to get my alcohol wipe, and I'm going to clean it from the inside working out, and then I am going to pinch it, and since it's subcutaneous and I can only pinch 1 inch, we're going to go in at 45 degrees. And we're going to inject, and then immediately after injecting, I'm going to put my needle in my sharps container, and I'm going to apply pressure with my alcohol pad on the injection site. And now that that is good, I would assist my patient to a comfortable position. I would lift them side rails up, and I would lower my bed to the lowest setting. And also, I'm going to remove my gloves, going glove to glove and skin to skin. Also take off my goggles. And then I would observe him and make sure that I don't see any allergic reactions going on, any anaphylaxis, any redness, swelling, anything like that. Make sure that all looks okay, which it does. And then I would document on my MAR my entire legal prescription, my drug dose, my route, what time I gave it, what it was for, and then if my patient did have any interactions, I would put that on there as well. And then I would also come back in a little bit and make sure that everything's looking good still, and just assess them and make sure that after a little bit of time nothing's happened as well. And that is my assessment.